Here, I selected 3 of the life-related disease can be resolved nutritionally by the cyclodextrin. First one, I selected diabetes. Here, risk of diabetes onset associated with statin. I want to talk first. Most of all people are going to the health checkup once a year, I suppose. Then, as a result of the health checkup, if you find LDL cholesterol level is more than 140 milligrams per deciliter, usually you are asked from the medical doctor to take medicine, statin. And of course, statin has an efficacy. Cholesterol biosynthesis is inhibited. That's why reducing risk of atherosclerosis. But recently it was found that there is a side effect, that is adiponectin secretion is decreased, then increasing risk of diabetes onset. It was found with a cohort study with 68,620 Japanese dyslipidemia. Without using statin, if you take the high potency statin like atorvastatin, pitavastatin, rosuvastatin, then your risk becomes 2 times or 3 times higher to be a diabetes. And the mechanism for the diabetes onset, usually for a long period, only two factors believed, genetic factor and also the environment factor, induced obesity by the high-fat diet. Only 2, but now we have to know the statin medication. 3 factors giving the decreasing secretion of the adiponectin, decreasing MPK, and the PPAR alpha. So in your body, triglyceride level is rising, then insulin resistance is increasing. This is the risk of diabetes onset. Not only increase of the risk of the diabetes, obesity, atherosclerosis, but also cancer risk also rising. So what is statin? Everyone knows. This is the inhibitor of the hydroxymethylglutyl coenzyme A reductase. And because inhibiting this enzyme, mevalonic acid is not produced. So in the synthetic route, cholesterol is available, and the cholesterol biosynthesis is inhibited. But in the same route, coenzyme Q10 is also synthesized. And the coenzyme Q10 biosynthesis is also inhibited. That means that's why adiponectin secretion is decreased. This was a risk of the obesity, diabetes, and cancer. So in case if you take the statin, please take the coenzyme Q10 as a supplement. And you can see by the statin medication, it is reported to decrease the blood coenzyme Q10 level. The pravastatin, simvastatin, and atorvastatin, the coenzyme Q10 reduction rate is 25 to 54%. So the coenzyme Q10 is produced in your body, but the production decreased from the 20s. And by the age of the 80s, production dropped to less than 40% compared to the age 20. Then can you imagine these elderly, can you imagine how much it will decrease by taking statin? Actually, coenzyme Q10 production and the number of the human cells are related, positive correlation. The coenzyme Q10 is the coenzyme for the ATP production to keep the number of the human cells. So when the number of the cell drop below the 23 trillion, human reach the end of life known. So this is really dead line. So Keio University reported that blood adiponectin level, that super elderly over 100 years old, twice higher than the Japanese average. Huge difference here. Statin medication for the elderly over 80 leads to the decrease of the coenzyme Q10 level and decreased adiponectin level and increasing apoptosis of the human cell. In other words, the statin can be said to be the aging accelerator. So the 1/3 of now Japanese population is elderly, including me. 1/3 of the elderly, this is not me, but elderly are statin users. That means more than 10 million people have a risk of the diabetes onset by the statin here. So the statin user should take the coenzyme Q10 together, but the coenzyme Q10 has a problem, fat-soluble substance with extremely low bioavailability. Here we found cyclodextrin could solve this issue perfectly. So first one is bioavailability enhancement, improving solubility in the small intestine by gamma cyclodextrin. 20 years ago, we found the bioavailability enhancement of the coenzyme Q10 bioavailability by the gamma cyclodextrin compensation. So those days already coenzyme Q10 is a pharmaceutical ingredient. So the pharmaceutical company developed already a drug formulation using oil emulsifier. So without using oil emulsifier, actually bioavailability is enhanced in case of the drug formulation. But compared to the drug formulation, gamma cyclodextrin complex is much higher. So those days, 20 years ago, we did not know why. Because here, coenzyme Q10 gamma cyclodextrin complex is not water soluble, but highly dispersible. So under the situation, why coenzyme Q10 is the bioavailability could be enhanced, we did not know. Around more than 10 years it required to find the mechanism. Today I cannot show you in detail about that, but I want to use a video to explain briefly. The coenzyme Q10 gamma cyclodextrin complex is not water soluble, so not soluble in the intestine. That's why amylase cannot attack to decompose gamma cyclodextrin. But in the small intestine, bile acid is available, and the bile acid fit well with the gamma cyclodextrin. So the coenzyme Q10 is going out, but via molecular missile, coenzyme Q10 absorbed well. Then obtained bile acid gamma cyclodextrin complex is water soluble. That's why the amylase can attack to decompose the gamma cyclodextrin into the glucose. This was the mechanism we found. So in bile, there are 3 key ingredients. So they are lectin, cholesterol, and bile acid. Everyone knows here they are in the cyclodextrin conference. Cholesterol is fit well with the beta cyclodextrin. Here we found the bile acid fit well with the gamma cyclodextrin. On this occasion, chemistry means their compatibility. So the good chemistry, gamma cyclodextrin and bile acid has. That's why bioavailability could be enhanced. So the next one is bioavailability enhancement, improving solubility in stomach by the gamma cyclodextrin. We selected alpha lipoic acid because it is a key substance to glucose metabolism in mitochondria. It is used as an anti-diabetic drug. Therefore, synergistic anti-diabetic effect of the RR and coenzyme Q10 expected. So then we evaluated the RR, but RR is unstable. That's why, because of that, bioavailability is not so high. That's why we try to stabilize with cyclodextrin, and we found also gamma cyclodextrin is useful to stabilize thermostability and solubility in acidic condition, both perfectly stabilized by the gamma cyclosin compensation, and also solubility. There other gamma cyclosin complex is higher, significantly higher than non-complex. You can see that. So there here stability and solubility both improved by the gamma cyclosin compensation. We expect, of course, bioavailability enhancement here. And at the Kobe University, we did study, a human study, and we see the actually AUC after administration of the complex and non-complex, then 2.5 times higher than the non-complex we found. Here, that's why we suggest for the 10 million elderly statin users, please to compensate the risk of the diabetes caused by statin medication. I would like to ask the medical doctor to recommend to take the coenzyme Q10 and other both gamma cyclosin complex. We reported improvement adiponectin secretion by the coenzyme Q10 gamma cyclosin complex reported in year 2010, and also the all other reported in 2013. So not only coenzyme Q10 and ALA, their bioavailability enhancing technology can be used for the not only both, but tocotrienol, curcumin, diosgenin, and many others we see.